Step 2 CK, and there used to be USMLE, Step 2 CS, but I think there's been a lot of back and forth about that in recent times. And then there's also a Step 3 exam that you can give if you have graduated medical school and are thinking about starting residency. So that is kind of the basic requirements before you are even eligible to apply for residency. After that, you have to fill out ERAS, which I think a lot of you might have heard of or are familiar with, which is the application portal that you apply to residency for. That's the basic requirements. And then comes all the adjunctive stuff, which is not essential, which is not a requirement, but I highly recommend it to make your application competitive. So there is research, and with research, superficial involvement in one or two projects here and there is not going to pay off because they're experienced people. They can see through what the project is and how much involvement have you done. And if you're last author on one paper, that's not going to pay off. You need to have a research project that you kind of see through from start to finish and have a publication to show for it. That shows them that you're a finisher, not just somebody who dabbles in different things and leaves them incomplete. There's also US clinical experience. That is also not required, but highly recommended because they look at your US clinical experience and the LORs that you get from there to see whether you would be somebody who can adapt into the system. The letters of recommendation are key. There are so many applicants with excellent grades, but it's your letters of recommendation that stand out because at the end of the day, being a doctor is dealing with people, your colleagues, your patients, administration. So at all levels, if you have somebody who is not good with dealing with people or is not demonstrating a good work ethic, that is going to be a problem. But if somebody has excellent letters of recommendation, where somebody is vouching for them, describing their work ethic, that really helps set your application apart. And then there's the filling out of the application itself on ERAS, which we can talk about. This is a figure that's there on the ECFMG website. Step 1 is your first step that you take. They have recommended guidelines, prep 9 to 12 months, while in med school, the score is higher, etc., etc. Now it's pass-fail. What I would recommend, and obviously you have to see your limitations and your ability to multitask at that point, is that when you start medical school, a lot of step 1 is basic science. So if you study your medical school curriculum properly, at the end of each rotation, you sit and you go through the same thing in the USMLE books. That's going to give you a really good foundation and put you on the way to give your step 1 by the end of third year. Although if you're somebody who finds multitasking very difficult and you're not being able to concentrate on your daily responsibilities as a medical student, then I would advise you to defer them to after graduation because you also need an excellent med school transcript to be eligible. If you have any failures during your medical school or at any stage, that automatically disqualifies your application, and that's just something I've seen, that failures are seen as a red flag in your application. Now, because step 1 is pass-fail, your step 2 CK score is starting to play a critical role. Because that is the only way us as IMGs are able to differentiate ourselves as being academically excellent and having the knowledge to be able to perform in intern year and residency. And then clinical skills, I don't know if they have any alternatives to clinical skill exams, but a lot of it is just history taking, communication, and standard practices. So if you're doing correct practices in your clinical rotations, you shouldn't have any trouble doing that. Step 3 is something that you do after you complete all of these steps. You apply for ECFMG certification, which you can do after you've done both step 2 and step 1, and you have graduated medical school. And that makes you eligible for this exam. It's not necessary, but it gives you a leg up in the process because programs don't want applicants who will fail step 3. If you've already passed it, then they look at your application a little bit more favorably, particularly the smaller programs. And then the other thing is that makes you eligible for an H-1B visa if that is something that is of interest to you. So then comes the ERAS timeline. After you have completed all your exams, you have to start working on your application. Your application is going to involve filling out the form that's there on ERAS. You need to describe all your rotations, clinical experience otherwise, voluntary work, research, other projects, and there are different fields in that. A big mistake that people make is that there are a lot of grammatical errors, and that obviously gives a bad impression because they think that you don't pay attention to detail. So don't think that you can just breeze through the application in 1 hour, put all your data in and move on. You have to kind of make sure that the descriptions are appropriate and really work to make sure that whatever you want to present yourself as is coming through. There's also a personal statement involved in this. The personal statement also, I would advise that you don't leave till the night before the application is due. If you start working on it 2 to 3 months before, that allows you time to refine it, rethink it, and make sure that you're presenting the best foot forward. A mistake that I've seen students from Pakistan do is that people often start writing about why I became a doctor. But you're not applying for medical school, you're applying for residency, you're already a doctor. So you have to focus a little bit more on what sets you apart and why you want to do that particular specialty. You cannot write kind of praises for yourself, but you can describe kind of incidents, things that you have done that allow them to have an insight into your personality characteristics, such as determination, being compassionate, being hardworking. There's that phrase that they say, show, don't tell. So you're demonstrating that through different stories that you are incorporating in your personal statement. And then if for the internal medicine match, the results usually come out in March, where you find out that you have matched. For ophthalmology, surgery, and some of the other specialties, they come out a little bit earlier. And the match process is quite fair because you can rank programs in order of preference and they can rank you in order of preference as well. So you don't have to rank based on where you think you will get in. You can just rank based on where you feel would be most appropriate for you. So those are kind of like slides showing a rough idea of the process. Things that I would also want to highlight is professionalism. They take professionalism very, very seriously. So if you do go on a clinical elective in the United States and you're there, don't assume that if you are kind of showing up late or not doing something, nobody is noticing. They don't give feedback because for them we're just an international visitor, right? But from your end, to get that good letter of recommendation, you have to be extremely professional. Show up on time, volunteer to do things, try and make sure that your notes are excellent, try and make sure that your patient communication is excellent, try and make sure that you are always putting your best foot forward and representing your institution and country well. Because if they get one person who is not up to the mark, they kind of block those spots for other students as well, unfortunately. If you do a good job, they are very good about supporting you and advocating for you and helping you get through the process. I think it would be better if we switch to a more interactive format now, so if anybody has questions, I'd be happy to take them.